Joining us now is an expert in this field. Dr. Diane Reidy-Lagunes is the Chief of Medical Oncology at Duke Health. Doctor, thank you so much for being here.
Thank you so much for having me.
There's so much to talk about. Talk me through this utero theory. Pills a mom can take while pregnant can cause early cancers in her child. Break this down.
So I think, it's terrifying when you hear something like that. But I think if we take a step back to understand why does cancer develop in the first place, cancer is what we call an accumulation of damage in a cell. And in a scary way, it usually takes many, many years, if not decades, for that to happen, which is why cancer, by definition, is typically a disease of aging. So that cell may actually get damaged early on in life, and then it kind of sits there, and then later on another damage occurs to the cell. So I like to use the analogy of like a bingo card. You need to get 4 or 5 mutations in that cell for it to unfortunately turn on and develop into a cancer. And so again, that usually takes a lifetime. But in a very scary way, as you described, we have 2 studies now showing that if you're in your 30s and 40s now, your chances of developing a cancer in your 30s and 40s is substantially higher than your parents would have been at that age. And so when we see data like this, it makes researchers think, what is going on? And we call that a birth cohort effect, where the generation itself is seeing a higher incidence of cancer. And so researchers say, okay, if that happens, often it's actually as early as development, in utero, in early infancy, and then in child development, that may be something there that actually could have caused the damage to see this generational change. And in fact, several researchers have in fact seen that there is a much higher risk when mom took certain medications.
What are those medications, Doc?
Well, we don't know for sure. And again, this is an association. It's not the magic, like we found the smoking gun here. But we know that certain hormone therapies that mom would take to prevent miscarriage and certain anti-nausea medications that were prescribed at the time to prevent emesis during pregnancy is much higher link to the development of cancer much later on in life.
Doc, I would love to know more about your personal experience treating young people. You've said you've seen fit, healthy people come into your office and they're still getting colorectal cancers.
I have many patients, stage 4 cancer, that are very active, running marathons. And so it's incredibly important to understand, the first thing I tell my patients is there's nothing you did or didn't do, particularly when you're in these very young ages. There are certain cancers that are linked to obesity and other sort of risk factors like sedentary lifestyle, but we've done many types of studies that show that is not the reason right now that we're seeing this increased incidence in these very young, very fit patients.
Are there 2 or 3 things we could all be doing to prevent a cancer diagnosis, or at least detect it early?
Absolutely. I mean, first and foremost, we have to know our own body. So for colorectal cancer in particular, any change in bowel movements that don't, sort of change over a couple of days to weeks, I want you to seek out your clinicians to further understand that. Any bleeding, and then any new masses you may find anywhere, whether it's in the breast or in any locations, just get it checked out. For men, prostate cancer screening starts at age 50 and much younger in African-American populations. And if you have a family history, at age 40. And breast cancer screening should start at age 40 with a baseline even earlier if you have family risks.
There's some research that points to PFAS. Those are forever chemicals in food packaging or those non-stick cookware. Have you heard about that? Is there a link there?
Absolutely. And in fact, investigators at my university at Duke are really looking into this with a big grant to really understand how these microplastics or these forever chemicals could potentially be playing a role in the development of this cancer. Again, it's many sort of damages or mutations over time that eventually cause it, and that may be one. And so we really need the research to better understand the science, because we can't wait another 40 years to see, could there be another generational issue? So I think the science and the research is so critically important to help us better understand what's going on here.
I do want to leave our viewers with some good news, because while we're talking about these negative, horrible headlines about cancer, there's a lot of progress too. More people are surviving it than ever before. Talk to me about that, and of course, any symptoms we should be looking out for when it comes to detecting early cancer.
100%. So the good news is absolutely more and more patients are living with cancer and being cured of cancer than ever before. And I think that's because of early detection, that we know our bodies, that we're being more advocates for ourselves, which is critically important. I think, again, any symptoms, whether it's bleeding from your bowels, whether it's something suspicious that you see, skin checks, skin cancer is still the most common cancer that develops, and it's real. And that is something early on can be treated, detected, and cured. So these are just really important sort of moments where we want to take a step back. And, the world, we're always running, but we want to take care of ourselves.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.